Today we are performing an extended abdominoplasty. We have a delightful 48-year-old patient who's had a great success with weight loss. She's lost 125 pounds, and of course what happens with weight loss is we get deflation, we get laxity, but we have a procedure that will completely correct this. So when considering the types of abdominoplasty, we base the decisions on our patient's preference and our patient's current clinical situation. Because she's had such a successful weight loss, we need to extend our abdominoplasty past the point where a normal abdominoplasty is performed. Typically, a full abdominoplasty is a procedure that has an incision usually from iliac crest to iliac crest. But when we've had such a successful weight loss, the removal must extend further back to completely correct the deformity. I've asked our patient to turn to an oblique view so we can see the extent of which we need to have our incision. Our incision must come at least to this point, which is actually in the mid-axillary line, far posterior to the anterior superior iliac crest, which is approximately here. So this is where we're going to begin our incision to remove all of the redundant skin to give her that really nice physique that will be consistent with her success in weight loss. The first marking in any abdominoplasty is to identify the low incision. It's disappointing to me when I see some of our colleagues leaving our patients with an upper abdominal incision, which is not ideal. The lower the better for the proper final result. Typically, the ideal location is at the level of the symphysis, and if we ask our patients to strongly hold their skin upright, and we feel where that level is and mark it, that will remove the upper third of the hair-bearing mons and keep our incision at the level of the symphysis. Okay, relax. This eliminates the need to anchor the lower scar to the abdominal wall to prevent it from rising. This will not rise. This will stay exactly where we put it, but it's done by having the patient help us with this first most important marking for all abdominoplasties. Now that we've marked our initial incision line, we will extend this in this natural crease until we reach the point, go ahead and let that loose, that we've gone beyond our deformity, our crease, and at this point we begin an upwardly curving line to the umbilicus. Many times surgeons will draw just a true ellipse from that point, but that's not really the ideal location, because we're going to be able to excise this skin, and as we close, which we'll see in the operating room, we're going to advance this upper flap, dramatically enhancing our waistline and giving us the very best result that we can achieve. So I finished the markings, and both sides are very symmetrical. From the midline to this point is 28 centimeters, which is significantly longer than our average, which is typically 21, possibly 20, 22. 28 bilaterally is 56 centimeters in length. And again, now we'll turn just a bit, it is not this elliptical pattern from this point directly to the umbilicus. It is a strongly upwardly curving incision that we're going to use for our final excision. But this is just a preliminary marking. I am not certain that I can get all of that skin out. I probably can, but to prevent any of this area from being thick, non-liposuction, I will mark this line, liposuction this intervening area completely, so that when we bring this down, there'll be no question that all of the area we liposuction is going to be in contact with the lower incision. We're not going to leave non-liposuction tissue just above the incision, which will remain as a small bulge, which we don't want to get. We want to eliminate that. We perform routinely thorough abdominal liposuction for virtually every abdominoplasty. It's done safely with an extremely low risk of ischemia and necrosis. and we'll talk about the importance of the thorough tumescent infiltration, reaching our tumescent state, exsanguinating the tissues, not having any blood stasis, not leading to microthrombi, ischemia, and necrosis. So we're going to mark the inframammary fold on both sides. We're going to liposuction the hips, the upper body in this area. We're going to create a nice midline sulcus and thoroughly lipo this upper abdominal area. We will also lipo the mons very thoroughly to match, because we want the thickness of both of these levels of tissue to be the same. This will be very thin. We'll probably liposuction this down to this, and then suction the mons in the same way. So very thorough liposuction is an integral part of a complete, full, extended abdominoplasty.